Systemic Lupus Erythematodes, submitted by Moren Kate Tang Kogo from LaSalle University, Ozamis. What is systemic lupus erythematodes? Systemic lupus erythematodes, SLE, is the most common form of lupus and may be mild or severe. It is an autoimmune disease that attacks its own tissues by affecting the blood vessels, vasculitis, and can involve almost every organ system of the body. This might be due to both genetic and environmental factors, which may lead to multiple immune system defects, including dysfunction of dendritic cells, B cells, T cells, leading for the patient to have autoantibodies. The abnormal production of immune complexes, autoantibodies bound to self-antigens, activating complement proteins, and autoreactive cells. The abnormal release of inflammatory cytokines such as interferon A, Illinois, 6-Illinois, 10. One of the risk factors of systemic lupus erythematodes is old age, as their immune system undergoes alterations, resulting in a gradual decline in its ability to regulate and respond appropriately to various stimuli. This age-related immune dysfunction may lead to an increased risk of autoimmune diseases like SLE. Second risk are women or the female sex, as hormones are thought to play a role in the development and progression of autoimmune diseases, like SLE. Women have higher levels of certain hormones, such as estrogen, which may influence the immune system and increase the risk of autoimmune reactions. Third is obesity, as this characteristic may alter the immune system's balance and function, which may contribute to the dysregulation seen in autoimmune diseases like SLE. Moreover, inflammation is a key feature of SLE, and the presence of additional systemic inflammation from obesity could exacerbate the disease. Fourth is hypertension, as this can further damage the kidneys and exacerbate the renal complications associated with lupus. Fifth is dyslipidemia. While dyslipidemia itself might not be a direct risk factor for SLE, certain medications used to manage lupus, such as corticosteroids and immunosuppressive drugs, can contribute to dyslipidemia as a side effect. Sixth is smoking. Smoking generates harmful free radicals in the body, leading to oxidative stress. This oxidative stress can damage cells and tissues, promoting inflammation and potentially triggering autoimmune responses. Lastly is a family history with SLE. There may be specific immune system characteristics that run in families and make certain individuals more susceptible to autoimmune diseases like SLE. These shared immune system traits could be influenced by both genetic and environmental factors. Symptoms of systemic lupus erythematodes includes low-grade fever, butterfly-shaped rash in the cheeks, fatigue and pain, swelling or edema, and weight loss. These are the medications we may use in controlling the disease. NSAIDs to control inflammation, elevate body temperature, and alleviate pain. Corticosteroids for controlling severe exacerbations of polyarthritis, and steroid-sparing drugs, methotrexate, for alternative treatment prescribed in combination with folic acid to decrease minor side effects of corticosteroids. As for non-drug treatments, we have rest/exercise. SLE can cause fatigue and weakness due to the immune system's hyperactivity and attacks on healthy tissues. Sufficient rest helps conserve energy and aids the body in its healing process. On the other hand, in some cases, exercises is still recommended, those that improve joint flexibility, muscle strength, and cardiovascular fitness, as they can be beneficial when performed in moderation and with proper guidance. Next is to limit sun exposure. Sunlight exposure has been linked to an increased risk of disease flares in patients with SLE. Flares can involve various symptoms, including joint pain, fatigue, fever, and organ inflammation. Next is to avoid smoking. Smoking further exacerbates this risk by causing damage to blood vessels, promoting atherosclerosis, narrowing and hardening of arteries, and increasing the likelihood of heart attacks and strokes. Next is to avoid certain supplements, including echinacea, spirulina, and vitamin E, as these might trigger or worsen autoimmune responses in these individuals. Patient teaching. Encourage patient for adequate nutrition and hydration. Proper nutrition and hydration help support the immune system, providing it with the necessary nutrients to function optimally and reduce inflammation. Certain foods, especially those high in antioxidants and omega-3 fatty acids, for example, fruits, vegetables, fatty fish, can help reduce inflammation and alleviate symptoms. Encourage to avoid prolonged periods of inactivity. Again, as mentioned, sufficient rest helps conserve energy and aids the body in its healing process. Instruct the client to clean, dry, and moisturize intact skin. People with SLE may experience skin rashes, photosensitivity, and discoid lesions, which can compromise the skin barrier's integrity. Maintaining a moisturized skin barrier helps to prevent excessive dryness, cracking, and further damage to the skin. Instruct the client to avoid contact with harsh chemicals and to wear appropriate protective gloves as needed. Certain chemicals may stimulate the immune system or cause inflammation, which can worsen the disease activity and lead to flare-ups. SLE prognosis. The survival rate for people with lupus has significantly improved over the past few decades. More than 90% of people with lupus survive 10 years or more, with many achieving a normal lifespan. Thank you for watching.